I'm just going to jump right into it. I'm going to read you a few comments from viewers based on homeless stories we've done. It's out of control. Poor San Diego used to be the gem of California. Where's the millions we have poured into helping the homeless? Maybe we need to audit these programs and see what they are really doing. I want to know how Coronado keeps them away. What's Todd Gloria doing about it? Your response.
What I sense in all those statements is frustration, and I share that frustration. I'm a San Diegan as well. I go about my day and I see what is occurring on our sidewalks and our canyons along our freeways. As a third-generation San Diegan, it makes me very angry to see this. What I think is often missing in those situations is context, both for what we're doing to try to address it and why it's happening. And I think that that's a story that we have to tell, and I appreciate this opportunity to do that.
So we just held the first homeless count in 2 years. We're expecting those numbers to be released within days. What can we expect from those numbers at this point?
I don't need to see the numbers to know that it's going to be bigger. And what I know is that that count is imperfect. I've volunteered for that count for many years, waking up early in the morning and doing that count. We perform it in January or February on what is often a cold or rainy day, and it affects the count. You know, people figure out a way to find housing under difficult circumstances, and if it's particularly cold, they will buddy up, they will call in favors, they will use their last nickel to get a hotel room, and that affects our count. So whatever the number is, we're required to share that to the federal government in order to get funding to help serve our homeless population. But at the end of the day, we know it's going to be bigger because there are so many pressures that are pushing people out on the streets, rising rents, more evictions, a mental illness crisis that we don't talk nearly enough about, a substance abuse crisis that is visible everywhere. There are so many drivers behind homelessness that the many effective programs that we're advancing here at the city are often hamstrung by the fact that we may be able to get hundreds of people off the streets, and we have, but there's often hundreds more that are falling onto the streets every day.
You know, I've been told by your office this is your top priority.
It is.
How often, I just saw some of the homeless outreach people in your office actually leave you when I came in. How often are you meeting about this? How often does this come up on your daily interactions about how to solve this problem?
Every single day. I live downtown. It is not uncommon as I'm walking out of my building to come to work. People talk to me about it, or that I don't see it myself personally. It is common in interactions with constituents, no matter what the subject and no matter where we are, a park opening, a charity dinner. This is on people's minds. And then importantly within this office, it comes up in all of our policy meetings, all of our council meetings, it's everywhere. What I think is different is the way that we've tried to engage it, to be intentional about it. If it is the highest priority in the city, then we need to act like it. So soon after becoming mayor, I established the office of a department of homelessness solutions and strategies, hired a director to come run it. Her door is 2 doors down from my door, meaning to say that every single day that I'm here, the person that runs point on this for our city sees me too. When we're here getting water out of our kitchen and filling up our water glasses, we talk about it. That when I'm passing by and I just had a conversation with a constituent, I can say, hey, listen, I heard about that there's a bad encampment at this intersection, that there's a person with a mental illness crisis happening here. Now, and then she has her team to be able to work on it. My point is that I've attempted to elevate this issue in a way that it hasn't been before. We didn't have a Department of Homeless Solutions previously. That individual didn't have an office next to the mayor's office, in the mayor's office. And these are the things that we're changing just to make it functionally the same as what San Diegans are saying, which is we want you to work on this more than anything else. I mean, Shannon, I think that's one of the things that's really telling for the acuity of this problem. In the middle of a pandemic and economic uncertainty, this is what people talk to me the most about. So it's, while they might be afraid for their health and the health of their family, they might be struggling with their finances because of a variety of things. This is what, when people see me on the sidewalk, in the streets, at events, is what they talk to me about. And I think that shows why we're elevating this the way we are in my administration, why we're funding it like we have never done before, why you see me in Washington and in Sacramento asking for reforms, trying to mirror the urgency that San Diegans really feel on this issue.
There is an urgency, but it seems like it's so slow moving. I mean, here's a 2-page list of all the things that your office has done and all the money that you've poured into this problem. And it's a fact. Your office has poured more money than in under previous mayors, but it seems like the problem is getting worse. I mean, you live downtown, you walk near the ballpark, go out front the post office. It's really, really bad. And it just seems like we're pouring money and pouring more shelter space into this issue, but is it working?
We are showing thousands of people who are not on the streets every night because of our shelter beds. We're showing hundreds of people transitioning from those shelter beds into housing, but it's still not enough. And this is a part of the education piece, because I think people's anger maybe blinds them to the facts and the circumstances we find ourselves in. The pandemic has been horrible for all of us, but it has been particularly bad for homeless individuals. And I respect the fact that if you're not on shelter, this may not have been your understanding. So allow me to educate. Social distancing for you and I may have meant that we stood 6 feet apart when we got our cup of coffee. For our homeless people, that meant hundreds of shelter beds that could not be used because we had to maintain social distance within our shelters. That impacts things, right? So yeah, you spend more than you ever have, but what you're paying for, you don't have access to because the public health order doesn't allow us to use those beds. We only recently got that capacity back, and we still struggle because when we have positive tests, it does require social distancing. Our criminal justice system has not been running at full tilt for the last 2 years. Our ability to book people into jail, our ability to hold them there with bail, these are things that have not been tools that are in our toolbox for the last couple of years. And so when people say, Mayor, why are there more people out there? You're doing all of this stuff. There are a multitude of reasons why, but I would say the primary culprit in the situation has been the pandemic. And that's why you've seen me be aggressive in asking people, get vaccinated, advancing the enforcement of the public health order. This isn't because we enjoy doing that, but we recognize it's what's necessary to put the pandemic behind us, not just for good public health, but because it is limiting our ability to respond to the biggest problem going on right now, which is homelessness. I will tell you, May 15th, bail is going to be reinstituted in San Diego County. First time in nearly 2 years. And what that means is not that all homeless people are criminals. That's not the case. But if you're a criminal and you happen to be homeless, or if you're not, if you're housed, either way, there ought to be consequences for your behavior. I would argue that a lot of the consequences have not been there for some time. And so some of your viewers who say, this stuff is crazy, this is criminal, there's something that should be done about it, well, the answer may be that we may not be booking people into jail for that currently. And we may not, even if we did, they probably can be let out on their own recognizance because we have zero bail. I'm excited about the fact that that ends this Sunday. And I think that will be another tool in our toolbox to help us to control the circumstances that are going on throughout our community, and often particularly within our homeless population.
And I think you bring up a great point, because often what our viewers say is that a lot of these homeless people are breaking the law. They're doing drugs, they've got chop shops with stolen bikes, they're defecating, they're urinating in public. If I did that, I'd probably get a ticket, right? But no one is out there, or it seems as though, giving them tickets or doing anything about it. And we've heard from officers that their hands are tied. Yeah. So are you saying that hopefully with bail reinstituted that maybe we're going to start seeing some of these laws actually in place where, people are being ticketed and, having consequences for these actions?
Absolutely. I believe it will help, and I'm very supportive of that. There has to be some level of enforcement. And I think that that's one of the tightropes that we walk. There's some folks for whom they want to excuse behavior from individuals because they happen to be homeless. I don't agree with that. If you are committing a crime, I don't care if you're housed or unhoused, you should be held responsible. And again, that's nothing to do with our homeless policies. That has been a response or a need because of the pandemic. We have seen, congregate settings that are jails, as being a means of facilitating the spread of the virus. And so I understood why this measure was necessary, but I have been pushing and lobbying our presiding judge and others to get these changes made. These are not decisions of the mayor. I don't decide who gets booked into jail. I don't get to decide whether or not we have bail. That is other people who make those decisions. And they have all heard from me about this change that I want. And the good news is we're getting the outcomes that we want. So there have to be consequences. Again, I want to be very careful. It is not saying all homeless people are criminals. Far from. But there are folks who are doing open drug dealing, open prostitution, other kinds of things that are not acceptable. And we have to be able to enforce upon them. And for our officers, their hands have been tied to the extent that maybe the crime that they're witnessing is not a bookable offense. Or if they did book that person in, it's almost futile because you could take them to jail and they may beat you back to the sidewalk, as you're walking back to your car. That may cause them to reevaluate, what calls they respond to. I want them to respond to all calls. I want them to respond to every call that is a crime, because there has to be consequences in an organized society. This is among the many prices we paid during the pandemic. And Shannon, I've been really frustrated because a lot of times people have been critical of my willingness to enforce the public health order, my desire to have a vaccine mandate, the promotions that we've done around vaccines. And they've acted like the spread of this virus hasn't been incredibly painful to all of us, not just our kids who couldn't go to school, but in our homeless ecosystem. I've seen people yell at me about this issue, and they don't understand that what they have been doing by helping to facilitate the spread of this virus has had direct consequences when it comes to our homeless situation. Another area we haven't talked about is encampment cleanups along our freeway. For the better part of the last 2 years, Caltrans were not doing that because CDC guidance said that that was not going to be helpful for curtailing the pandemic. Now, we've resumed that, and the city has decided to partner one of our homeless service providers with Caltrans so that when they go out and do those abatements, that we're not simply moving folks from one freeway intersection to the other. Governor Newsom came to San Diego to highlight this as a best practice. Other cities are now following our lead. I understand if San Diegans aren't aware of that, or don't necessarily see the fruits of that work just yet, because it's only been in place for a short while. But my point is that as more of our tools are returned to us because we have been able to reduce infections, increase vaccinations, it's allowing us to hopefully make a meaningful difference in what people are seeing along our freeways, in our sidewalks, in our streets.
Some people have said we're turning into San Francisco, which has a notorious homeless situation. But on the flip side, are you looking at other large cities across the country that don't have such a huge homeless problem and asking yourself, what is it that they're doing right?
Well, I'm always interested in learning from other people's experience. I was a history major in college for that reason. I recognize you don't have to reinvent the wheel. You can look to other examples and try and adapt them to your circumstances. But Shannon, the fact of the matter is there is not a mayor I speak to across this country that is not dealing with this exact same issue. Communities that have long been heralded for what they've been able to do are dealing with this situation. City of New York, you see that they've long been a right to shelter community, but they now also have encampments on their sidewalks. This isn't a community where they are required to provide shelter for these individuals, and yet there are still people ending up in encampments on the streets. Washington, D.C., Chicago, Seattle, San Francisco, L.A., everyone is dealing with this. I spoke at a recent conference of mayors on the issue of homelessness, and when my comments were completed, I was swarmed by my colleagues who are from cities big and small, on the coast and in the interior, in red and blue states, everyone dealing with it. Guy followed me into the restroom, Shannon. That's how much other mayors are feeling under siege by this issue. And they're asking us, well, what can we do? And I will tell you that, whether it's our coordinated street outreach, our expansion in shelter beds, the construction of more permanent supportive housing, we are implementing what are understood to be best practices in this space, and we're also trying to find new ways to address this issue, and whether that's the Caltrans service provider collaboration to make sure freeway cleanups are better, or our demands around behavioral health reform. I think one of the biggest areas that we can make a difference is changing the state's laws when it comes to how we interact with severely mentally ill people. Our current threshold of saying that if you're not a threat to yourself or to someone else, that we're just going to let you be, is wrong. It is not based in common sense. There is no San Diegan who would look at some of the individuals who are allowed to walk around our community and say that they are clearly capable of caring for themselves. They can't. So let's stop acting like they can and change the law so that we allow compulsory responsibility on the individual to get care and on government to provide that care. Because what we currently are doing is leaving our most vulnerable people to die on our streets, and that is wrong.
You answered my next question, which is, obviously it's a multi-pronged approach, but what's the one area we can work on the most? And I think mental health is so key, because you can build more low-income housing, you can increase shelter space, but when you walk down the street and you see people that are clearly mentally ill, they are not going to a shelter, and they're not the ones looking for low-income housing.
Yeah.
They don't even know where they're from or their first name.
Correct.
And that's what a lot of people see as being the problem. It's not the woman or the man that lost their job during the pandemic and now they're living on the street. It's these people that just need mental help.
Yeah. Well, I want to be clear. We have to serve all of them.
Right.
But it is true that there is a group of individuals who find themselves unsheltered who are relatively easy to serve. They may need some minimum subsidies, a little bit of job training, maybe a little bit of housing navigation, and they're good to go. There are other folks that require more significant interventions, and we have those opportunities. But where I see a huge need is for the severely mentally ill. These are folks who are dealing with psychosis or substance abuse disorder, and it really prevents them from being able to accept the help that is provided. And that really requires changes in state law. You have seen me stand with Governor Newsom at the announcement of his Care Corp proposal, because I see that as being one of the ways that we can disrupt the status quo on homelessness, do something different, innovative, something that other states might choose to replicate, as well as testify in support of bills in the legislature to change our conservatorship laws. These are things that when I was in the legislature just a year and a half ago were unthinkable. These bills are now advancing through the legislature on bipartisan, unanimous votes, because legislators all across the state, red and blue, interior and coastal, they all see it. It's not just a San Diego thing. Everyone is dealing with this. And so what I'm saying is that we have to continue to help those people who need minimal assistance. We have to work with those folks who may need a bit more. But for this group of folks that are so difficult to reach, we have to help them. We have to change our laws and our programs to assist those people, because those are the people that I think San Diegans are most troubled by. They're the ones that stick out. A lot of our homeless blend in. Your restaurant server, your daycare worker, there's any number of people who you probably interact with on a daily basis that you would not know are sleeping in their cars or couch surfing. The ones that people notice and get frustrated by are the people standing on a street corner screaming. There's a man in my neighborhood who walks around without pants on.
Yeah.
And so the answer right now in California is that if we approach them with one of our outreach workers and say, would you like some assistance, and they turn us down, that's the end of the conversation. And that is just wrong. We have to be able to follow up and say, with deep respect and with complete understanding that civil liberties are something that we have to cherish, these folks are not capable of making that decision for themselves. And we have to provide them with advocates and supporters and due process, but we have to find some way to say that it is not okay to leave our severely mentally ill people on our sidewalks. What I'm encouraged by is that that conversation that was basically nowhere a year or two ago is now seemingly everywhere, and I actually do have relative confidence that something will happen this year. The governor's been clear. He wants this done this year. I believe that if on our current trajectory, those modifications and reforms could be adopted before the fall and hopefully implementable according to the governor's timeline by January 1st, 2023.
It's promising to see that progress, and hopefully it comes through. But I think obviously you have to ask yourself, well, what about the resources?
Yeah.
Because, okay, so now you have the law behind you where you can go up to someone who's clearly mentally ill and get them forced help, so to speak. But when you take them to a place, are there going to be enough people to help them? Is there going to be enough space in a facility that's able to help them?
That is absolutely the next question, but that's, it's an iterative process. First, we have to get agreement that this is what we want to do as a society, and it's just a no-brainer to me. Like, how can we, as a civilized society in a city, state, and nation as wealthy as ours, to allow these people to be on the streets? So I think we can get that agreement. Then the next step is, how do you actually implement it? What the governor has proposed under his Care Corp proposal is real repercussions for communities that don't provide that kind of services. I'm here as the mayor of the second largest city in the state saying I will accept those responsibilities if I'm given the tool of providing the compulsory responsibility to accept the services. And if I may, this is a very complex subject that you want to put some specificity on. And what I want people to think of this as is public education. We have a compulsory responsibility when it comes to public education, both on the parent and student to be educated and on school districts to provide the schools, the teachers, and the textbooks to actually do education. This is essentially what we're arguing for when it comes to severe mental illness, that there's a compulsory responsibility to get services and on government to actually provide them. And that's what this legislative action is intended to do, to create that responsibility, that circular responsibility. Everyone has skin in the game and everyone has to deliver, both the individual who currently often decline services and on the responsible parties at the state, county, and local levels to say we will provide those services.
I'm just doing a time check because I know you have another event, but I did want to ask you, I know that this isn't just up to you in the city, you're collaborating with the county, and we've heard people on the board be very vocal about what we need to do and be very vocal about working with you.
Yeah.
Do you think that the county is doing their part? Do you think they're doing enough?
They're doing more than they ever have. And this is a bright spot. I think previously, particularly when I was a city council member, it was difficult to get the county of San Diego to engage on the issue of homelessness. And under the leadership of Chairman Nathan Fletcher, this has been very different. Could they do more? Yes, I'd always like them to do more. The problem is enormous. I'd like the city to do more, and my budget requests from the city council reflect that. But what I will tell you is that you can look at the fact that prior to now, the shelters that have existed in our community are largely city funded and led. It's usually a City of San Diego initiative in partnership with a nonprofit provider like Alpha Project or Father Joe's. What in the last couple of months you've seen is the first time the city and the county are collaborating on shelters. We did our first one. It's our Sea Heart shelter on Sports Arena Boulevard. We took an old city facility, partnered with Alpha Project in the county, and all three of us are providing shelter beds at that site right now for severely mentally ill individuals. We're partnering as we speak to stand up another 150-bed shelter on county property. The city will be providing operational dollars. We're going to partner with Alpha Project. They're providing both the behavioral health workers and the property. What you're seeing is greater collaboration between the city and the county, and we need to do more of that, and I believe that we will. I think another area where more need is the fact that this is no longer a downtown San Diego issue. It is no longer just a city of San Diego issue. All 18 cities in this county and the unincorporated areas see the kinds of encampments that you typically have not only seen in East Village. And that is sad, but it's a fact. And that's why other cities have to also engage on this matter. They have to start providing shelters. They have to start constructing permanent supportive housing. They have to have homeless outreach. It's not sufficient for the city. We certainly have the majority of the population, but we do not have the entire population. And so we need collaboration, because what I know from San Diegans is they do not care which side of the city limit this unsheltered individual is on. They want that person served. And I couldn't agree more. So if they're on the City of San Diego side or on the National City side or the Del Mar side, whatever the case may be, all of those cities have to have some skin in the game. They have to be willing to provide solutions to this very significant problem.
Well, it's a complex issue, and it won't be the last time we speak. I didn't get to everything, but I know you're very busy. My final question is, if we were to sit down this time next year, you think the problem will be, do you think the homeless issue will be better? Will we have less people living on the streets? What do you foresee in the next year?
I would like to be optimistic in this regard, in part because this collaboration between the city and the county is real, and it's going to deliver hundreds of additional shelter beds over the next couple of months. Because I believe the state will take action to address behavioral health reform, and that certainly will help. That the COVID restrictions that in some cases have made the situation worse will continue to abate. And so things like bail, social distancing, and other things that have been constricting will get better. That's a reminder to San Diegans: continue to get vaccinated, take this virus seriously, and please do your part to not spread it. So I think those are things that trend in our favor. I think we'll have 450 additional shelter beds in the next couple of months. That will go a long way to helping people. We know in the first fiscal year to date, we've exited 600 people out of our shelter system into permanent housing. They're not going back to the streets. They're off the streets for good. If we can continue on that trajectory, it's good. Let me tell you what I am worried about. I'm worried about rising rents and evictions, so that every individual we get off the streets may be replaced by another family that just got evicted from a rent increase they couldn't sustain. Inflation and what that does to household budgets, and people making really unfortunate and difficult decisions that may result in them ending up on the streets. The mental health crisis that we do not talk enough about. And I'm not talking just about the severely mental ill things, but you see the shootings, you see the violence. A lot of that is mental illness driven. That kind of stuff does result in people becoming homeless, and we need to get our arms around that. And drugs, specifically methamphetamine and opioids, particularly fentanyl. Part of why San Diegans are so frustrated by this situation is these drugs that previously were not a large part of our homeless population. It was always there, but it is just writ large. And when you see good reporting today about the number of deaths that we're seeing in terms of overdose deaths, while most of those deaths happen in people's homes, in their businesses and hotels, out of sight, out of mind, a lot of this is occurring in our encampments. And so I have optimism when I think about the collaboration with the county, the growth in our shelter beds and permanent supportive housing beds, the potential for behavioral health reform and continued progress on the pandemic. But I worry a great deal about evictions and rising rents. I worry a lot about inflation. I worry a lot about mental health, and I worry a lot about substance abuse disorder.
Well, I appreciate you, again, sitting down with us, your transparency, and when we have more time, we'll have to discuss all of these issues further, because obviously we're not going to, get to everything in 30 minutes, but I do appreciate your time.
Oh, I appreciate yours and your willingness to talk about this. It's the
Yeah.
biggest issue out there. It's complex. There are no simple solutions to this problem. It is extremely complex. Our challenge has to be that we're willing to provide a variety of offerings in order to address people's individual concerns. And I appreciate the chance to be able to tell this story to San Diegans who understandably are frustrated. I want them to know I'm frustrated as well, but that doesn't deter me from engaging on this matter. If anything, it's caused me to roll my sleeves up and work harder. And we can change the narrative on this situation. I ask for people's partnership. I ask for people to understand that primarily this is a housing issue, and that we have to be willing to open up our communities to provide the kinds of services that we know end homelessness. And that can be often scary. But I would encourage San Diegans to look at some of our existing facilities. We have homeless shelters on the 2300 block of San Diego Avenue in Old Town Mission Hills. You would have no idea that dozens of homeless veterans live at that facility. 6th and A is one of our larger homeless shelters. It's generally, I think, a very well-run operation. Rescue Mission, which is on Elm Street and front in downtown San Diego, hundreds of homeless families and women that live there every day. You would not know that those are facilities that are operated as homeless shelters, and that should be what people envision when I share with them that every neighborhood has to be a part of the solution. It's not about large encampments, it's not about a lot of queuing and feeding operations, it's about providing people the basic human decent dignity of a home, of a bed. We need to build a lot more of this, and I look forward to being able to continue to explain to San Diegans what effective solutions look like, and then to work with them to actually deploy it, because we cannot claim to be America's finest city if we have 8,000 homeless people living on our streets.
Just keep chipping away. All right. Thank you so much.
Thank you.
Appreciate it.